Today, we confront two fundamental challenges that define the strength and character of any healthcare system: the ongoing battle against a devastating pandemic and the critical task of managing the people at the heart of our work. Part 1. The HIV and AIDS pandemic, a multifaceted challenge. The HIV and AIDS pandemic remains one of the most profound challenges of our time. It is more than a health issue. It is a crisis that reverses developmental gains, devastates quality of life, and places a heavy burden on healthcare, education, business, and entire communities. It impacts workforce productivity, economic growth, and social stability. Effective management is not just a medical necessity, it is essential for sustainable development. The spread of the virus is fueled by a complex web of factors: poverty, which limits access to care; migration, which carries the virus across regions; gender inequality, which disemowers women; and ignorance and cultural beliefs that perpetuate stigma and denial. Managing this pandemic requires a response as multi-layered as the problem itself. It exists within several critical contexts. The global context, guided by organizations like the WHO, ILO, and UNICEF, which provide treatment guidelines and advocate for rights. The constitutional context, which in countries like South Africa enshrines the right to equality, privacy, and access to healthcare. The corporate governance and human resource context, where national codes and labor laws protect employees from discrimination and ensure fair treatment. The purpose of our management is clear: to reduce the spread, mitigate the health and economic impacts, and do so in a way that is ethical and upholds human dignity. This involves a coalition of role players, employers and employees, collaborating for a non-discriminatory workplace, healthcare professionals implementing treatment strategies, and organizations running comprehensive workplace programs that focus on prevention, care, and support. Ultimately, the effectiveness of our response hinges on our commitment to moral responsibility and our ability to overcome the deep-seated challenges of stigma, fear, and conflicting social views. Part 2. Human Resource Management, the engine of our organization. If managing a pandemic tests our resolve, then managing our people determines our capacity to fight it. Our human resources are not just employees, they are our most important asset. Human Resource Management, HRM, is the strategic practice of attracting, developing, and maintaining a workforce so that every individual can contribute to our organizational success. HRM does not operate in a bubble. It is shaped by powerful external forces, economic changes that affect jobs and salaries, technological advancements that demand new skills, political and social factors that influence employment law and workplace culture. The purpose of HRM is to navigate this complex landscape to support both employee well-being and organizational growth. Its key objectives are to provide a well-trained workforce, maintain a supportive environment, utilize skills effectively, and uphold fair labor practices. The HRM process is a continuous cycle across 6 key areas. 1. Planning and provision, forecasting needs and recruiting the right people. 2. Maintenance, ensuring employee welfare and safe conditions. 3. Utilization, using employees' skills efficiently. 4. Performance management, evaluating and guiding performance. 5. Development, training and upskilling for the future. 6. Fair labor practice, guaranteeing equity and justice. This process begins with the critical foundation of job analysis, which gives us 2 essential documents: the job description, which outlines the duties and responsibilities of the role; the job specification, which defines the ideal person for the job, their skills, education, and qualities. From there, we move to recruitment, attracting a pool of candidates, followed by selection, the careful process of choosing the right person. Once selected, the appointment is made official, and a proper induction welcomes the new employee, integrating them into our culture and setting them up for success. Underpinning all of this is the employment relationship, which is not just an economic or legal contract, but a social and psychological one, built on unwritten expectations of loyalty, fairness, and commitment. In conclusion, these two fields, HIV/AIDS management and human resource management, are deeply interconnected. One challenges us to protect our society from a pervasive threat with compassion and strategy. The other challenges us to nurture our greatest internal strength, our people. By managing the pandemic with integrity and our people with wisdom, we don't just build a healthier organization, we build a more resilient and humane world. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.